Basic concepts in providing psychotherapy care. A psychiatrist in the Russian Federation is a doctor with higher medical education and previous expertise in psychiatry. Helps people with neurosis, a completely curable disease, encourages the patient's personal growth. Psychiatric patients with severe mental illness do not treat people, advise consultation with a psychiatrist. A psychiatrist in the Russian Federation is a doctor with a certificate in the specialty of psychiatry. He can consult and treat mentally ill patients with serious mental illness, prescribe medication, evaluate people, and determine their mental health and disability. Psychologist, someone who has psychological training. Can conduct training, help to choose a career, test the level of intelligence, identify abilities, give advice, give suggestions. Can't diagnose, treat, help with drug selection, detect disease. In the presence of symptoms of neurosis, contact with a psychologist does not replace a visit to a doctor. Psychologist, a type of psychologist who has specialized additional training in psychotherapy. A type of psychotherapy. This specialty is absent in the Register of Medical Specialties of the Russian Federation. Has the right to engage in psychotherapy. Can't make diagnoses, provide treatment, help with drug selection, diagnose disease. Psychological connection, if any. Neurological symptoms of anxiety do not warrant a visit to the doctor. Psychotherapy information received from the patient is completely confidential. Health workers, relatives of the patient, do not communicate to the work of the patient, law of the Russian Federation. Referral to psychotherapy from another doctor is not required, law of the Russian Federation. A patient who has had contact with a psychotherapist will not be registered, law of the Russian Federation. Ask the therapist to get a driver's license and not a license for a firearm. A qualified neurologist, therapist, cardiologist, if there are signs of neurosis, he will certainly treat the psychiatrist, but he will not treat the disease of neuritis himself. According to the World Health Organization, WHO, in the last 65 years, the number of people with neurosis has increased 24 times. People of all ages are affected by these diseases. Average age of onset of neurosis is 6 years, 5 in boys. The girls are 6 to 5 years old. Frequent neurotic disorders in Russia: stress or anxiety, sexual compulsive disorder, nervous disorder or panic attacks, social phobia or social neurosis, cardioneurosis or cardiac neurosis, reactionary neurosis or hysterical neurosis, irritable bowel syndrome, post-traumatic stress disorder, anorexia nervosa, and bulimia. Difference between neurosis and psychosis. Psychosis is a mental illness that can be treated by a psychiatrist. Neurosis is a completely treatable disease that is treated by psychiatrists. Ignore the onset of mental illness. Neuropathy has an obvious onset, usually preceded by mental trauma or chronic stress. Mental illness, manifested by mental disorders. Neurosis is not mental, but mainly vegetative, somatic, and emotional disorders. Psychosis, the patient is not aware of his illness. Neurosis patient is very worried about his problem, remains critical of reality. Mental illness causes changes in the patient's personality. The neurosis patient identity remains the same. Mental illness is hard to treat. Nervous, if not stimulated, it is a reversible state. To solve the issue of diagnosis and treatment, consult a doctor personally.